This is Abia COVID-19 update.
Abia COVID-19 update.
COVID-19 is spread from aerosols. That's the tiny viral particles. We breathe in aerosols in crowded places and we touch our face inadvertently, numerous times with potentially infected hands. Masks protest against all this and will be even more crucial now that the lockdown has been eased to prevent the resurgence of cases. It is alarming to note that despite the rise in cases of COVID-19 pandemic, most people are beginning to discard their face masks or use it to pass checkpoints, an early sign of user fatigue. This is dangerous. The directive of the federal government and state government, Abia state government, making the wearing of face masks compulsory is still in force. Besides, it is still in force even in the global context, so the pandemic has not been conquered anywhere. Preparations for the resumption of flights and the lifting of the ban on interstate movement should not be interpreted to mean that the dreaded coronavirus disease is over. This laxity is observed everywhere, in the cities and also in the villages. And this is surprising as even the powerful are still being reported to have tested positive for coronavirus scourge. Nigerians must, as a matter of necessity, continue to wear face masks to protect themselves and others since it is globally recognized and approved as the strategy for curbing the spread of this virus. There are no two ways about it. Nobody should wait to be forced to wear a face mask, especially now that community transmission of the disease is on. The rules and the guidelines are there for people to follow and protect themselves from the deadly virus. So that has taken a ghastly toll on economic and social life around the world. I need to let you know again that the use of face masks and hand sanitizers on market dates and in public places where more people are gathered are non-negotiable to limit the spread of the virus until the scourge blows over. Welcome to another edition of the program. It is Abia State COVID-19 update, the second edition for the week. Today being Tuesday, the 7th of July, 2020. My name is Michael Oni. On this program, we highlight daily reports of the Inter-Ministerial Committee on the Control of COVID-19, as well as the Abia State Governor, Dr. Okezie Ikpeazu's efforts in ensuring that the state is safe from the virus. This program is running simultaneously every weekday from Mondays through Fridays on several radio stations: BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, all in Umuahia, the capital of Abia State. We are also live on Bars 89.7 FM and Real 99.1 FM, both in Aba, the commercial capital of the state. Let me bring you up to date on figures and updates on coronavirus globally. A global number of deaths is standing at 540,860 as at 8 a.m. today. Meanwhile, the total number of infections worldwide stands at 11,748,985. Also, the number of recovered cases is at 6,742,608. India's death toll has surpassed 20,000 as the country moves ahead with plans to relax its nationwide lockdown. This morning, the country reported 467 new deaths from the coronavirus, bringing the total death toll to 20,160. It also recorded 22,225 new confirmed cases. New cases and deaths in India are both rising at their fastest pace in 3 months. Nigeria's COVID-19 infections yesterday surpassed the 29,000 mark as the country reported 575 new cases of coronavirus. 575 new cases, bringing the total number of confirmed cases to 29,286. 9 deaths were also recorded yesterday from the virus, bringing the total number of confirmed deaths from the virus to 654. As at the time of reporting, all 36 states and the Federal Capital Territory have recorded at least a case of the disease. It means Cross River State was also on the chart yesterday. Lagos State remains the epicenter of the disease in the country. Zamfara State has not reported any new confirmed cases in the past 48 days. Abia State recorded 6 new cases yesterday. And of course, till date, we have 29,286 cases that have been confirmed in Nigeria, with 16,804 active cases of those over 29,000 cases. That's because 654 deaths have been recorded, and also some persons have recovered. That's 11,000, over 11,000 have recovered. Now, the number of samples that have been tested right from the first time the index case was reported in Nigeria, we have 152,952 samples that have been tested in Nigeria. It is Abia State COVID-19 update. Let's go straight to the discussion this morning. On the program, we have Dr. Chigozie Adindu joining us. He's the Abia State Primary Healthcare Agency, the executive chairman of that agency. Doctor, can you hear me? Good morning to you.
Oh, yeah, I can hear you loud and clear.
All right, that's great. My name is Michael, and we're taking I understand that you're the executive secretary of Abia State Primary Healthcare Agency.
Oh, yes.
Okay, that's wonderful. Now that we have community transmission to battle with as far as COVID-19 pandemic is concerned, especially in Abia State, can you tell us your experience from rural areas?
All right, thank you very much. As a matter of fact, the primary health care is the closest level of health care to the members of the public. Of course, it is the grassroots. The members of the public will access primary health care services before, they can be asked to go to secondary or tertiary levels, as the case may be. We are very, very close to the people, and we interact with them. We have our presence felt in the 292 political wards in Abia State and the 17 LGAs. Immediately we got to know about COVID-19. The first thing my organization did was to train the health workers in the primary healthcare sector on the etiology, pathogenesis, and prognosis of the disease. So it will be easy for them to detect, people that are suffering from the disease. So it's very simple and common. When people have cough, when they have cold, when they have fever, they will go to the nearest health center. And if our people are not aware, they don't know how to handle such cases, then they may contract it. So we took a proactive measure by first and foremost training the health workers. We trained over 3,000 of them, and we've been interacting with members of the public. And of course, we have our health facilities linked to the Abia Telehealth calling center. So it's always easy for us to refer cases to the isolation centers, treatment centers, or to the secondary and tertiary hospitals that we have in the state. The experience we've been having, just like every other organization, for us, we have a formidable pool of health workers, and of course, that the intricacies and dynamics of handling ailments are within the competence of the professional and academic background of the health workers. So whenever we get complaints of cases, we look at it critically and do the needful. The members of the public have been cooperating with us, and of course, we've been interfacing our services with aggressive sensitization. When people come to the health centers for antenatal, postnatal care, immunization, family for anything, we make sure we lecture them on COVID-19, and it has been helping us, So far, we've been having a tremendous relationship. We've been referring cases, and that is why Abia is doing greatly. We've been detecting cases early enough, so that it will not overwhelm the system.
Okay, Dr. Chigozie, you will agree with me that as the country grapples with COVID-19, strong primary healthcare can provide a critical first line of defense and response to keep the people safe and healthy. What is the referral process, and how effective has it been?
Well, the process is simple and it's streamlined. From primary health care centers Of course, we have 722 primary health care facilities in Abia State. We have we divided them into clusters. We have general hospitals. From there, cases are referred to other tertiary hospitals, like the specialist hospital, Amachara, FMC, Absolute, and all the rest of them. So it's been we have a robust relationship with all these other levels of healthcare delivery system. And when we're in difficulty, of course, they come to our aid.
Interesting. Primary healthcare is the foundation of health and the well-being at every stage of life. And as it stands now, those are the hinterland. That's actually their first line of response to healthcare, good healthcare. Now, the question is, are your health workers well trained? Because of some of the symptoms of COVID-19 and some of those issues that we come across on the daily activities, like the fever, like the common cold, and of course the cough. Are they well trained to be able to distinguish and of course take the necessary action in case they come across symptoms of COVID-19?
So yes, as a matter of fact, we have many categories of health workers in the primary healthcare sector. We have the disease surveillance officers. We have the officers in charge of health facilities with social mobilization. So what we did was just to train all of them for them to first and foremost know what we mean by COVID-19, the signs, the symptoms, and then how to handle such cases. We equally made it a point of duty to ensure that these people will queue in and of course bring their professional expertise to bear so that we can be able to detect these cases. How we are trained, that's the question. One, the first one, we had a visual training from the National Primary Healthcare Center. It was organized, and at that level we trained over 180 trainers. And after that training, we had a local government level training where we trained over 3,000 primary healthcare workers. It lasted for 4 days. And after that, we now went to the various political wards. We trained the health workers from various facilities, the officers in charge and their deputies. We equally train people from private hospitals and mission hospitals within our areas, of catchment areas. So the training lasted for 1 week. From the community too, we trained at least 10 persons from each political ward in the state. So it was a massive training that lasted for days, and of course the state COVID-19 team equally assisted us. So we've had so many trainings, and I think my workers are doing fine. But up till now, we've not had any of them.
In case any of your worker comes across a suspected case of COVID-19 in Abia State at that level, the primary healthcare level, what will they do, or what do you expect them to do?
Well, to call the Emergency Operations Center immediately. Then they will come and then collect samples from the fellow. And if it requires moving the person to the treatment center, they will come immediately. Of course, we also have this Abia Telehealth Initiative hotline. So it's very easy for us to communicate.
Okay, Abia Telehealth Initiative helpline it has been very helpful, especially in the fight against COVID-19 in Abia State. As it stands now, that's the helpline we're also using for COVID-19 in Abia State, just in case of any suspected case now. How has it been able to smoothen your work at the primary health care level in Abia State?
Thank you very much for the question. It's been wonderful. It's been tremendous. After the training, of course, we have about 3 or 4 trainings as it has to do with that 21st century indigenous innovative network. We call in the center anytime, any day. When people come to our health facilities and the health workers there think it is necessary for them to consult because we don't have sufficient doctors at the primary health care level. So they just call in the center and then the doctors there will give them directly. It's been helping us, honestly. We've been leveraging on that to ensure that we give quality health care to our members of the public.
Now, the issue of the personal protective equipment, especially the fight against COVID-19, is very important for health workers. Do you have enough of these PPEs?
Well, as a matter of fact, enough fairness, we don't have enough. But of course, we know how important these things are. And we've gone out of our way to ensure that we reach out to some philanthropies, members, public spirited individuals to assist us. Some time ago, each one had one. Engineer Nana Wafo, right? Assisted us and gave us some PPEs, nose masks, hand gloves, even pockets, which we stationed in our various health centers. And not only that, the National Primary Care Development Agency equally assisted us with infrared thermometers, which we are using in over 85 of them in our health facilities. And of course, we've asked our people to equally try the much they could. As an agency, we've been able to even provide customized nose masks and hand gloves, which we have distributed to our workers. We don't have enough at the moment.
Okay, to be specific, Dr. Chigozie, to be specific,
Yes.
which one, what are those PPEs that you need now? Are they the hand gloves or the overall? Which ones are very important that you need?
Yeah, for us to perform our duties effectively without contracting this disease, first and foremost, we need the nose mask, sufficient quantity. Of course, it might interest you to know that we have 720.
That's the medical nose masks, not the regular cloth face mask being worn by everyone.
And then we have 4,693 primary healthcare workers across the state. We need the face mask, we need the hand gloves, we need the coverall, everything, because people come to these facilities. And of course, since we reorganized the health sector, we have the primary healthcare, we now have patronage. People now have confidence and they troop to the primary healthcare centers. So our workers there should be protected. They need adequate quantity of these PPEs.
Okay, at every level, right here in Abia State, we are still battling with the issue of stigmatization. Now, I don't know how your workers are coping, the workers of the Abia State Primary Healthcare Agency, especially those of them that go to work every day and return back home. Have you had any one of them report to you that they are being stigmatized at home?
Yeah, that one is, of course, we know we are always experiencing these things, but it's part of the training we give them. And of course, we are reaching out to members of the public. And from time to time, we carry out programs to actually teach the people on the need for them to, because COVID-19 is not a death sentence. It's a viral, just like any other viral infection. You shouldn't call for stigmatization. We've been having that viral infections and even more deadlier ones. And of course, even this one, the mortality rate is very low. I wonder why people should stigmatize health workers or people who tested positive to COVID-19. So we are going on with the sensitization and with the campaign. At our various health centers and our various gatherings, we teach people the need for them to actually accept people who test positive and incorporate them into what they are doing. Only for them, but the most important thing is for them to adopt, to comply with the procedure, COVID-19 procedure and precautionary measures that are in place.
Dr. Chigozie Adindu, Executive Secretary, Abia State Primary Healthcare Agency, thank you very much for your time this morning on Abia State COVID-19 Update.
Thank you very much.
This is Abia COVID-19 Update.
Abia COVID-19 Update.
The program is still very much live on several radio stations in the state: BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Buzz 89.7 FM, and Real 99.1 FM. And of course, the lines are very much open now for you to participate. 0808 182 6949, 0811 605 2949. You can also drop messages on 0906 510 8289. How are you fighting the coronavirus, and how are you stopping the spread of the coronavirus in your environs? Now, the Following the ease of the lockdown by the federal government and the recommendations by the Presidential Task Force on COVID-19 for phased resumption of schools across the country, some decisions were taken yesterday during the Presidential Task Force on the COVID-19 briefing, and those decisions were made public. WAEC will start on the 4th of August. It will run through till September. And of course, the Honorable Commissioner for Ministry of Education in Abia State, Dr. KCK Owangwa, will be holding a segmented consultative meeting with stakeholders in the education sector to brief them on guidelines for strict compliance of COVID-19 protocols for schools in Abia State. And accordingly, the Honorable Commissioner will meet with some stakeholders, the National Association of Parents and Teachers of Nigeria. That's on Monday, 13th of July 2020 at the SCMB Auditorium in Umuahia by 10 a.m. The National Association of Proprietors of Private Schools, their meeting will be on Tuesday, 14th of July 2020 also at 10 a.m. at the same auditorium, SEMB, that's the Secondary Education Management Board Auditorium in Umuahia. Then All Nigeria Conference of Principals and Secondary Schools, that's the ANCOPS, Wednesday, 15th of July 2020 at the same auditorium by 10 a.m. That on Thursday, the National Union of Teachers will have their meeting, and the association will have its meeting with the Honorable Commissioner on Thursday, 16th of July 2020 at the same auditorium. And on Friday, 17th of July, it will be the turn of the head teachers of local education authority primary schools. Now, it's very important that things are put together to ensure we follow some of those guidelines and assure safe reopening of schools for those are the final years, primary 6, GSS 3, and of course the SS 3. Now the lines are very much open: 0808 182 6949 or 0811 605 2949. Hello, good morning to you.
Good morning.
Yes, you're welcome.
Yeah, my name is Uchabu.
Okay, you're welcome, Uche. What's your contribution?
Okay. My contribution about the way we fight COVID-19. Fighting COVID-19, many a times, one person alone cannot achieve it. It needs the effort of everybody and the government as well. One day, I went to a court, here, and inside the court premises, there was no running water. So I told the woman I met, how could it be that here in a court, that two people don't have running water? And if somebody is caught outside the court with the society, the person will be brought to the court for a judgment. How is it that even in the court here that there's no running water? So in my presence, she ordered someone to bring the running water. Secondly, can you hear me?
Yes, I can hear you. Just wrap up your thoughts quickly.
Yeah, I was in a pharmacy shop in Umuahia here, and a COVID-19 patient came all the way from Abia Specialist Hospital, Amachara.
You mean a suspected COVID-19 patient or a COVID-19 patient?
A confirmed COVID-19 patient came to a pharmacy shop to purchase drugs. The drugs are HCQ. The doctor that you interacted with should know the drugs I'm talking about. HCQ and macrolide. The patient whispered to the attendants, and because of my relationship with them, I was able to get the information from the attendants of the pharmacy premises. He said that he was saying that he was asked to go out and procure drugs. The patient left Abia State Specialist Hospital on his and came to the town to buy drugs, macrolide and the HCQ and some other drugs. I couldn't stay
Okay.
to see all the drugs that he procured. So I want to say that the government has to teach us a lot, because some people
All right.
feel that the government are not telling us the truth.
We got that. Thank you very much. And I can assure you that the government is listening, and something will be done, and investigation will be carried out on some of those things you revealed this morning on the program. It's very important that we keep staying safe. It's the collective responsibility of everyone. When you do not practice preventive behaviors, you increase the risk of spreading COVID-19 to your parents and the elderly. Do not put their lives in danger. Take responsibility to protect them. Observe physical distancing. Wear a face mask and wash your hands frequently. My name is Michael Oni. The program returns tomorrow.
This is Abia COVID-19 Update.
Abia COVID-19 update.